First, meet Mary, who is a home care nurse. She visits clients in their homes and helps them with their healthcare needs. She works independently and has certain tasks to complete at each visit. How can Mary help to accomplish our strategic direction of strengthening and focusing our commitment on health equity and health promotion? We all know that each individual and each family that interacts with the health system has different strengths and challenges that they face. In this case, Mary is visiting a home of a single mom who also lives with her elderly parents. Her mother requires ongoing support from home care for some of her ailments. Mary promotes health equity by taking the time to understand the daily challenges that this family faces. Why is there always a shortage of healthy food in the home? Why are the mom's prescriptions never filled on time? And should grandma be babysitting? It might require a different level of understanding because mom has a difficult time keeping a job while caring for everyone in her home. Mary decided to check with the public health program to see what resources might be available for this mom. Now mom is getting support through the Family's First program and has connected with other community resources she never even knew existed. Building relationships and understanding with clients will help everyone work towards achieving health equity. Next, meet Alan. He works as a maintenance staff at one of our sites. He works hard each day to accomplish his tasks and follow the procedures of the job. How can Alan help achieve the strategic direction of designing programs and services for better access and optimal service delivery? As he walks through the facility each day, Alan is often asked for directions to different areas of the hospital. He notices that people are often frustrated because they're not sure where to go and become late for appointments. Alan mentions his concern to his manager at a staff meeting, and other people quickly agree that this is a problem they notice as well. Alan's supervisor brings his concern to the facility manager, who agrees to create clearer signage in the hospital to help people know where to go for their appointments. Even though many staff members had noticed this problem, it was Alan's concern that created a change. This improvement will have a positive impact on staff and on clients. Our third staff member is Danielle. She has an office job and doesn't interact directly with patients. She's responsible for a database for patients who need diagnostic testing. Let's find out how Danielle has helped to transform and improve the patient experience. Danielle notices that certain fields in her database are usually missing information. She looks at the forms that patients are asked to complete and finds them a bit confusing and repetitive. Sometimes, patients were sent for the same test by multiple providers. Danielle comes up with an idea to create a new form, which essentially replaces 3 forms. Wording is simplified and all essential information for providers is included to ensure that next steps are taken. Almost immediately, fewer appointments were missed, which also helped to reduce the wait times. Because Danielle takes a lot of pride in her work and helped to make the process more efficient, she really made the patient's experience and navigation of our system much simpler. Our final staff member is Lois. Lois is a registered nurse at one of our long-term care sites. She works long shifts to help provide quality care to a wide variety of residents and clients. How can Lois help to achieve our strategic direction of attracting and retaining a skilled and engaged workforce? For Lois, it's always been important to actively seek opportunities to learn and grow. Lois heard about an infection prevention and control session, and although she feels she already knows a lot about the subject, she will make sure to attend. Lois often looks for personal development opportunities and shares these learnings with her coworkers. And even though Lois is not a recruiter, she is helping with retention and creating a positive work environment. Mary Ellen, Danielle, and Lois have all helped to make the strategic plan successful. Along with helping to achieve the goals of the strategic plan, each of these staff members demonstrate our core values of integrity, compassion, excellence, and respect. No matter what job you have in Southern Health-Santé, we are all part of the same team. Remember, small changes and small acts really can have a great impact.